Medical News Network, I'm Esther French, reporting from the AAAS annual meeting in Washington, D.C.
As physicians, we're taught to think about and manage chronic illness as if it's an ever-present condition, and that rationalizes why people need daily treatment. But a big chunk of our patients with chronic disease are actually thinking that they're only sick or only have a problem when they're having symptoms, and that really have sort of an acute episodic model of the disease. And so they're thinking about their diabetes or their asthma or their hypertension as if it's a cold or flu that's only active when they're feeling particularly bad. And this correlates with what they're doing with their medication, with their other sort of self-management behaviors, and explains a lot of the poor control we're seeing as docs. Patients who had this acute episodic model of their disease, this sort of out of sight, out of mind idea, had much lower rates of adherence with medications, much lower rates of other self-management behaviors, and we know from other studies that when people do that, they're going to do badly. And so we think this is one of the most critical things that physicians who are working with patients with chronic illness could really try to get into, and figuring out, is the patient thinking about things the way I want them to or not? And then if they're not, how do I get them a little farther along to buying into the idea that chronic illness is there all the time, that there's a strong importance and rationale for taking medicines every day, even if they're feeling okay on average, and that this will benefit them in the long term.
For Global Medical News Network, I'm Esther French.